all, you're listening to Discover Your OT Path. My name is Riley Heiser, and I'm a student at IU Kokomo, currently enrolled in the Occupational Therapy Assistant Program. For my capstone project, I'm creating a podcast to help current students learn about the various settings available to them. Today we're diving into the setting of hand therapy. I'm excited to be joined by Debra Sturm, who is currently an OTD, MSOT, and a certified hand therapist.
Hi, Riley.
Hi. So before we dive on in, can you just tell us a little bit about yourself?
Sure. I have been an occupational therapist for going on 28 years now. I started out more of a generalist therapist. So I worked in an outpatient hospital setting where I first got exposed to hand therapy, but then I was also doing inpatient care, rehab, and some pediatrics because I was working in a JRA clinic, a juvenile rheumatoid arthritis clinic. So then from there, a move took me up to Wisconsin, and I got a job at a hospital doing outpatient hand therapy, and then also doing some acute care and some rehab as well. But then I decided that I was just going to make us the best hand therapy in southeast Wisconsin. And so we just slowly built up our relationships with our hand surgeons in the area, and we made it to the point where we had 3 full-time hand therapists. And so that's what I was doing for quite a long time up in Wisconsin. Then another move brought me to the job at the Indiana Hand to Shoulder Center. And I have been there since 2011. And it's a great place. I love it. So I'm just doing strictly outpatient hand therapy now. I guess I probably should have gone back and told you that I did graduate from Midwestern University in Downers Grove in 1997. That was harsh to say. back in the last century. And I've been doing pretty much working full-time as a hand therapist ever since.
For anybody listening, I did have Debra as a professor, and I absolutely loved it, so I'm sure I've already asked you this question, but what do you think are the key differences between like Wisconsin and Indiana, or is there any key differences?
Oh, yeah, that's a good question. So a lot of the therapy is pretty much the same. Maybe I might have noticed that people in Wisconsin tend to be more specially certified in like manual therapy than Indiana, but I think it has more to do with the education that's available up there. But the biggest difference that I find is insurance.
Oh.
Insurance, especially with work comp insurance, it's a lot more, it covers a lot more in Wisconsin. And even like therapy for like pediatrics, welfare, that kind of like Title 19, I think is what they call it.
I'm pretty sure.
Yeah, is a little bit more, it covers more up in Wisconsin than it does down here in Indiana.
All right. So can you describe your workplace for us?
Sure. So the Indiana Hand to Shoulder Center, we have 23 therapists. And we have one main hub, which is in Indianapolis. And then we have multiple outlying clinics. And one of them is in Kokomo, and that's where I work, Kokomo, Indiana. And we have a very small clinic. There's 2 therapists that work together. We're full-time here. And if you've ever been to a hand therapy clinic, it's a lot different. It's very open. So you would have basically just one big, huge room, and we have multiple tables. Now, we only treat one patient at a time. There's not any way that you can physically put your hands on more than one person at a time.
Yeah.
I fortunately work in a great location where they don't make us see multiple patients at once, which I know some therapists try and do that. they'll like start somebody on modalities, and then they'll do manual work on someone else, and then they'll put someone else on an activity, and they're like maybe seeing 2 or 3 patients at a time. I don't have to do that. And my facility is great in that I don't have to have a specified time that I'm spending with the person. So if I feel like they need an hour and a half, I'll book them for an hour and a half. I try not to do that because that just is too much time. Or if I only need 15 minutes, I book them for 15. So it's just very, just whatever I professionally feel, in my opinion, is what they need for treatment.
I didn't even know that was an option. That's cool.
Yeah. And then I work with a physician. He comes, I have 2 different physicians that come in, and they're here 3 to 4 times a week. And then usually he'll see a patient, and then he sends them over to me, and I'm doing something called splint room, where I just take whoever walks over from the doctor. I just do like a quick, like 15-minute kind of triage kind of appointment, where I'll just do whatever the order modifies. So like maybe he wants us to focus on edema control, so I'll do that. Or he wants them to start new passive range of motion or active range of motion exercises, then I'll do that with them. And then I schedule them back with me for a longer treatment later on.
Yeah. So you mentioned you work with a physician. Is there any other professions that you work with?
Yeah, I work with an x-ray tech. And then once a month, I have a physical therapist that comes, but he doesn't actually do physical therapy. He does EMG studies for carpal tunnel or any kind of nerve-related injury. So we collaborate a lot on that. So he'll be like, hey, I'm seeing this, and this patient that you have. And so we'll kind of talk about what I found in the clinic, and then he'll do his EMG testing, and then we kind of talk about what he found. So it's kind of interesting because we've had some like patients that come in and they present one way, and I totally think, okay, this is what it is. And then he'll do the EMG testing, and he'll be like, no, it's a brachial plexus problem. It's not just ulnar median nerve. This is a brachial plexus. So it's kind of fun that way.
Yeah. So amazing as your setting sounds, nothing can be perfect. What are some of the biggest challenges that you face in this setting?
So I think in this setting, the biggest problem is stress.
Yeah.
Because this is like, in this setting, literally, if I do something wrong, somebody's thumb will fall off. They will lose an appendage. And so you always have to make sure that you are, like, you're bringing your A game every single time with every single person, because if you mess up, you can really do some serious damage to someone.
Yeah.
So it's very stressful. And then, we also put a lot of stress on ourselves because we're all like type A personalities, right? And so we hold ourselves to a very high standard of care, and we actually hold each other accountable to a very high standard of care. And so it's nothing for your coworker to be like, hey, you didn't do this. You should have done this last time. You need to make sure you do this next time. That's normal for us around here.
Yeah. On the tough days, so like say you have a hard client that you really need to focus on, is there anything you do to make it a little easier and de-stress a little?
Well, I always try and make sure that I prep ahead of time. And when I'm prepping ahead of time, I'm kind of thinking about what I'm expecting to see. What happens if I don't see that? So I have like plan A of what I'm going to do and plan B of what I'm going to do. And you have to kind of be able to pivot pretty quick if something's not working. And then I also just kind of really make sure that I'm really in tune to what's going on, because, with hand injuries, a lot of them can be really severe. And so it doesn't just impact them physically, but it's like emotionally, mentally, what's going on with the family, that sort of thing. So you kind of get drawn into all that. And I think that it makes people feel like they're more cared about and cared for if you can like ask them questions about, hey, last time we talked about this, how's it going? Is it any better? That kind of thing. Mm-hmm.
All right. Hey guys, we're going to take a little break from the interview, and I'm going to ask an MSOT question. A client with radial nerve palsy demonstrates an inability to actively extend the wrist and fingers. which interferes with grasp and release during daily activities. Which orthotic would best support functional hand use? A. Resting hand splint. B. Volar wrist cock-up orthotic. C. Counterforce elbow strap. Or D. Dynamic finger extension splint. And the correct answer is D. D is correct because a dynamic finger extension splint assists with finger extension while allowing active flexing, enabling functional grasp and release in clients with radial nerve palsy. A is incorrect because it typically is used to rest the hand in conditions like arthritis or severe inflammation. B is incorrect because it stabilizes the wrist but does not assist finger extension. And C is incorrect because it's used for lateral epicondylitis and does not address radial nerve palsy. And now we're back to the interview. All right, so now on the opposite end, what do you absolutely love about this setting?
Oh my gosh. Well, first of all, I kind of like the gore, right? Times, but that's okay because it really, I really enjoy taking someone who has just the worst injuries and seeing them through to the point where, they're going back to work or they're doing something that they absolutely love doing, like their hobbies or what have you. And it's very, very rewarding. I like the fact that I can treat people how I want to treat them. Like I'm not being told you need to see them 3 times a week for 45 minutes.
Yeah.
Like I have autonomy over my schedule and who goes on it. Mm-hmm.
That's good. What is something that people on the outside might not expect when they're working in this profession?
Oh gosh, that is a good question. What would they not expect? I don't know, because I feel like this is what I've done for so long. It just seems, everything seems normal. Like I'm thinking about if you were to come in and watch me in a clinic, maybe perhaps you might be a little surprised at how wounded some people can be, like after they've had a really seriously bad accident, like firework injury or something like that. Maybe.
I feel like something when I was at one of my fieldwork sites that I didn't expect that they went to hand therapy after. They had such a terrible hand. I don't know exactly what they did. I think it was something with a tractor that they actually put their hand. They put it in their body, and sewed it. Or yeah, so
yeah. It's groin flap. Yeah, that is. See, there you go. That's something that I don't think twice about seeing, and that is something that probably would really freak people out to see their hands sewn inside their groin.
Yeah.
And then they'll take them out, and then a lot of times they'll just have a big pouch over where their fingers are supposed to be, and then as it heals, then they'll have another surgery to isolate the fingers.
Yeah, so whenever they came into the clinic, they were still in there. We hadn't seen what it was out, but I remember thinking that is so different.
Yeah, that is true. Yeah, I didn't even think about that. Yeah, so probably some of these diagnoses that I'm seeing, that I see so frequently, that would probably be the biggest shocker, right?
Yeah.
And then, gosh, I think maybe the speed at which we treat people. I know that has surprised some of our students in the past, where you might, you're seeing people every half hour, every hour, whatever, but you can go for, and the variety, right? So we'll see somebody with the groin flap,
yeah,
and then the next person we see just has a carpal tunnel release. Oh, okay, I'll take out your 2 stitches. Okay, you're good. See you later. So I think maybe the dichotomy of a point of diagnoses that we see. Yeah.
So for any students or listeners who might be considering a similar career or work environment, what kind of person do you think would thrive here? So could you give me 3 traits that you think would really fit here?
They have to be very confident, right? Because somebody who's got a really horrible injury doesn't want to see you wishy-washy or maybe uncertain about what kind of splint to make, or uncertain about their stages of their wound that are being healed. So you have to be very confident. You have to be an independent learner.
Mm-hmm.
So, you have to really study a lot.
Yeah.
There's a lot of times, even now, after all these years, I'll come across something and I have never seen it. And so then I'll go home and I'll search it out, and I'll find all the ins and outs of their diagnosis. So you have to be very motivated into studying. And then probably the third thing is you have to be able to deal with stress.
Yeah.
Someone who has a lot of anxiety probably would not do well in this situation because it's stressful.
Yeah.
Mm-hmm.
All right,
Yeah.
so before we finish up here today, is there anything else you'd like to share about your work setting or just an experience that you've had?
Well, I think that this is a really rewarding profession, really rewarding. And you get to meet some of the most amazing people, right? And you get to hear these great, great stories. And I actually have a lot of patients that return to come back and see me. And not just because they're injured, but they just want to see me, right? So, like one of my most probably, I don't know, I have so many people that I just kind of carry with me, that have been so rewarding, and I just think about them from time to time, wondering how they're doing. But I have one person who was a police officer, and he had picked up a firework that had unexploded to get it out of the way, and it went off in his hand, and it amputated he had his pinky. It amputated his index, middle, and ring fingers from his PIP, the middle joint, physically, and he lost the tip of his thumb. And he was so worried about being able to return back to duty, and kind of a young guy. And we got him back, but like it was. I'm sure some people thought we were crazy because I made him bring his gun, not loaded, but I made him bring his gun so we could practice dry firing it, just to see what we needed to do to what exercise I needed to give him, or if I could make some kind of splint that would help stretch so he could get around his gun.
Yeah.
All kinds of stuff like that. I made him try and take me down on a mat one time. Pulling was going to be his problem, and he was like, I don't want to hurt you, and I'm like, bring it, let's do this. And so he had to try and grab me, and I was trying to get away from him, and he managed to get me down, but he had to work for it.
Yeah.
He had to work for it. So but I've done all kinds of fun things like that, and it's rewarding every time you get to see somebody leave,
Yeah.
and they've got their hands back. So
well, I love that. Thank you so much, Debra, for letting us know all about working in hand therapy. We really appreciate you being here.
Well, thank you for asking me. This was great.
Yeah. Thank you to everyone for listening. I really enjoyed being able to do this project, and I hope that you found it beneficial to learn all about different settings. I hoped you discovered your OT path.